The webinar is now live.
Good evening, everybody. This is the National Council of Asian Pacific Islander Physicians Conversations with NCAPIP. We're going to wait just about 30 seconds to allow our substantial audience to click in on the Zoom. Thank you for your patience, and most of all, thank you for joining us. We're seeing the numbers go up. Well, let me just get started as we continue to have folks phoning in and joining us on Zoom. My name is Winston Wong. I am the chairperson of the National Council of Asian Pacific Islander Physicians. I'm also the acting CEO right now. I would say that one of our purposes for this webinar is to familiarize you with our name, the National Council of Asian Pacific Islander Physicians, also known as NCAPIP, because as it goes, ours is not the easiest organization to roll off the tongue. So you will hopefully at the end of this webinar be much more comfortable referencing NCAPIP as an organization that is prominent in terms of trying to advocate for the issues of Asian Pacific Islander, Native Hawaiian, Pacific Islander health across the country. We were formed about 10 years ago, and as our name reflects, we are a council of Asian Pacific Islander and Native Hawaiian physicians, i.e. we're not an individual member organization, but we do represent hundreds of different physicians that are working in our communities, whether it be in academia, whether it be at community health centers, whether it be in private practice. And many of these physicians are also part of independent practice associations and other organized physician groups. So this gives us an ability to have a large footprint. And as you will see today during our panel, we have some esteemed board members that represent the diversity of Asian American, Native Hawaiian, Pacific Islander physician voices. I should just mention a few housekeeping points here. This is being recorded, and for all of you who've called in and for people who've registered, you can view this video later on, and you will be provided that link. In addition, if you want to put any comment on the chat line, we actually would welcome you to identify your organization, what kind of practice you're in, if you're a clinician, or if you're working in health policy. It just gives us a good sense of who our audience is and how we can build a webinar in the future that meets your needs. The other thing is that we will have a Q&A session right after our panelists interact. You will note that there is down on your menu a Q&A function. So we would encourage you to put questions there when prompted, not on the chat line, but more on the question and answer section. So with that, I just wanted to acknowledge that many of us are celebrating Lunar New Year, the year of the ox, as I'd like to say 1/3 of humanity is. And if so, we hope that your families are safe and sound and will have a prosperous and healthy new year. Secondly, I think it's important for us to acknowledge that this is Black History Month. And as all Americans, we can celebrate in the life and history and the struggle of our African-American, fellow African-Americans that have been part of the struggle for us to build a better and just society. So hopefully you're acknowledging and celebrating in that observance. One other thing, today we celebrated the most recent landing of a US adventure to Mars, and that's something pretty amazing. It's something that reminds us about the stretches of humanity and how science and the imagination of our family can really be able to reach the farthest corners of the universe. So that's really something. So what we have today is the first in our series of conversations with NCAPIP. And our purpose is over the ensuing months is to have a monthly webinar where we will have, like in this format, a very informal kind of conversation with important topics relevant to Asian American, Native Hawaiian, and Pacific Islander health. They won't necessarily be clinical. They will be far-reaching, and we'll also have individuals that come from other parts of the health the health community, not just from NCAPIP. So we hope to cover issues like mental health, cover issues such as seniors, cover issues around pipeline and the issues around developing youth, etc. So please give us your suggestions for a few future topics that we will entertain over the course of this next year. And that again is Conversations with NCAPIP. So without any further ado, I'm going to hand it over to Ignatius momentarily, but I did want to just introduce our panelists today. First, we have Dr. Martina Kamaka, who is calling in from the islands, from the island of Oahu in the state of Hawaii, and she is the president of the Association of Native Hawaiian Physicians. We have, and we're most honored to have on our board of directors, Dr. Ken Moritsugu, who was acting Surgeon General and was the first Asian American that served in that capacity and had a wide purview of the public health system across the United States, as well as being the commanding officer of the Public Health Service Commission Corps. So thank you, Dr. Moritsugu. And we also have Dr. Sheldon Riklon, who is of the University of Arkansas School of Medicine. He is the only Marshallese practicing physician on the continental US, as I believe, and has been a leader with regards to the issues of health and public health issues, particularly among the Marshallese in the southeast portion of the United States. So Dr. Riklon, thank you. And I'll hand it over to Mr. Ignatius Bao, who's been prominent in really addressing Asian American issues, health issues, Pacific Islander health issues, Native Hawaiian health issues for many decades now. And Ignatius has been a real hero and champion of our community, as well as supporting NCAPIP all these years. Thank you, Ignatius.
Thank you, Dr. Wong, and welcome everybody. We really want to make this a conversation and leave a lot of time for questions and answers. So while you're introducing yourselves in the chat, please also write in any questions in the Q&A box as well. So let me start with Dr. Moritsugu. As one of the first Asian Americans to serve in the role of Surgeon General, you have served at the highest levels of the federal government of the Department of Health and Human Services. How are you viewing the incoming Biden administration and how its policies might impact our Asian American, Native Hawaiian, and Pacific Islander communities?
Well, thank you, Ignatius. To say that I'm excited is an understatement with the advent of the Biden-Harris administration. This administration has committed to have an administration that reflects all of America with the diversity of membership that we have in our society. And given that, I think that this administration, which is just about 1 month old at this point, has already been putting together its lead members of the administration. Obviously, our Vice President, Kamala Harris, is an African American and an Asian American, sitting in the #2 position of our federal government. We've got the U.S. Trade Representative, Catherine Tai, the Director of the Consumer Finance Protection Bureau, Rohit Chopra, and a number of other individuals who have already been appointed and are identified. The Surgeon General of the United States, a nominee, a person whom we have been familiar with in the Obama administration, Dr. Vivek Murthy, is awaiting Senate consideration and confirmation as well. I also perceive and anticipate an increased amount of communication and an increased amount of public involvement as the Biden-Harris administration implements its promise to have to consider all Americans as part of its fiduciary. I would underscore the fact that this is a new administration. They're still filling positions, and if there is anybody on the on this call who has any interest in it, I would encourage you to contact the Office of Presidential Appointments and let your interests be known.
Great, thank you. So Dr. Wong, NCAPIP is already engaged with the administration. Would you outline what you see as priorities to raise as Asian American, Native Hawaiian, Pacific Islander health issues with the Biden-Harris administration?
I think certainly at this point, it's all about COVID-19. And it was very interesting that before COVID-19 was happening, we were certainly agitating about the importance of diversity in all aspects of public health. And when COVID-19 happened, it really accelerated that work, principally around the fact that we didn't even know where COVID-19 was hitting in terms of the different communities that we were serving. And I know, Ignatius, you were very key in terms of disaggregating whatever little data that we had at the state and federal level. But this was such a key factor. And I think what's happened over the several months as we've been living through this pandemic is basically the story of Asian Americans and Native Hawaiians and Pacific Islanders burden of COVID-19. It's been undertowed. It's been underreported. And that's really been kind of the focus of much of NCAPIP's work. Just as a story, I was asked to make comment before the National Academy of Medicine as they were preparing recommendations around the distribution of vaccines for different tiers of priority populations. In their first draft, they didn't even mention Asian Americans and Native Hawaiians and Pacific Islanders. And I'm glad that myself and another party around Asian American issues, brought that up. And then the subsequent version did include our communities as being important in terms of priorities for distribution. The other thing too is I was asked to make a comment when Moderna was applying for its emergency utilization authorization. And I don't think that if left to be, some of the issues around Asian Americans and Native Hawaiians and Pacific Islanders would not have been heard. So I brought up the fact that you have to consider COFA, the Compact of Free Association, as impacts Pacific Islanders, how that relates to distribution of free vaccines, because it's a very complicated issue. So I think we have to focus on COVID-19 right now, but also we have to think in anticipation of what I would say the convalescent phase of COVID-19 and how that's going to impact our communities. One of the issues being mental health, and one of those issues being the uprise and uptick that we see in hate crimes relative to Asian Americans. And not just the fact that people feel fearful and unsafe, but this is a mental health issue with regards to communities that are isolated, socially isolated, particularly our elders, that are really fearful of just venturing out and buying groceries because of potential xenophobic attacks or racial attacks.
Yeah, Winston, if I could just jump in here and comment on your identification of COVID-19. COVID-19, and historically we think about it, there is a definite beginning and a definite end of the infection. But I think with COVID-19, we're also seeing an increasing number of a phenomenon called long COVID, and that and how that will have an impact on people of color, and particularly Asian, Pacific Islanders, Native Hawaiians as well.
Yes.
Absolutely. And so, Dr. Riklon, you've been at the center of that particular pandemic in Arkansas. And if somebody didn't know that there were Marshallese in Arkansas, they might be surprised to see the numbers of Pacific Islanders with COVID cases. So talk about that experience and how the community has really rallied and responded.
Thank you for the question, Ignatius. Definitely, yeah, there's a large population of Marshallese of all places in Northwest Arkansas. We're estimating close to about 15,000 Marshallese residing here. They work and they live here since the late 80s, 90s. But the pandemic, it definitely has devastated the population, the community. It definitely has been challenging. We've had high rates of Marshallese getting infected, getting hospitalized, as well as dying from the disease as well. And, one of the few things that are positive from this pandemic, is it brought out all these systemic issues that always were there, that many of us have been advocating for many years. But now with this pandemic, brought it out more in the limelight, that we need to understand the community that we're trying to take care of. And with the large population of Marshallese being disproportionately affected by this pandemic, we had to work together. For us Micronesians, for us Marshallese and Pacific Islanders and Native Hawaiians, we take care of our own. We try to take care of our own just like a family. And many of the things that we did in trying to kind of address this, we basically had to have people work together. We had to work with the community through leadership, trusted leaders. You had to kind of put names and faces and voices of the people that you're serving in the front line so they can understand it. So we, besides getting interpreters and health navigators and contact tracers, we had to approach it in a way that was culturally and linguistically appropriate. And that's how we've been kind of trying to handle this. So since July, our numbers were high. I think estimated CDC report at that point was about 19, almost 20% of the Northwest Arkansas community cases were Marshallese, and we comprise only 2.4% of the population here. As of earlier this month, I'm very happy to report that that has steadily come down, and now we're down to about 6-point-something%. So it shows that how we've been collaborating and working with others actually works. But for you to kind of address that in a community, in a population, you need to have them be with you, engage with engaged leaders that gonna go forward with that.
Great. I don't see Ignatius's face anymore. I don't know if something happened technically. But Ignatius, are you there by any chance?
Looks like he dropped out. He was frozen earlier.
Okay.
Yeah.
But I do know that Dr. Kamaka, you've been really educating us about some of the special circumstances and challenges we have with the Native Hawaiian community and how the Native Hawaiian community has been at the center of the burden of the pandemic in the state of Hawaii. Can you comment on that?
Yeah, sure. I'm happy to comment. First, I want to, and Ignatius is back. I just want to make a really quick correction. I'm the immediate past president of AANHPI, although I'm still very active on the board. So just wanted to quick put that in. So, what's been interesting in Hawaii, when we first had indications nationally that our ethnic minorities were at increased risk for COVID, and many of us, we all have the same disparities with cardiovascular disease and cancer and obesity and asthma. These are all the same across all of our health disparate populations. When we had a clue that this was impacting our health disparate populations, we grew concerned about what was happening in our Native Hawaiian Pacific Islander population. most of the country wasn't looking at our data. And, there's, if anything I've learned from this is the power of data. And so what happened was we started asking our Department of Health, because they were just, they weren't doing ethnicity data. And we started asking them, the community, what's going on with our Native Hawaiian Pacific Islander population? We know they've got the same health disparities that our Native American and Hispanic and Black populations have, that are suffering from COVID disproportionately. And then we started a few places like King County in Washington started publishing NHPI data, and it was horrifying. It was astounding, the impact on the NHPI, and which even added more fuel to our, please, what's going on in Hawaii. So Hawaii finally did look at our NHPI. They didn't separate us out, and there was a disproportionate impact. But we wanted more. Our community wanted more. We wanted to know what's going on with Pacific Islanders, because we have a pretty significant Pacific Islander population and Native Hawaiian. But what about other Asian populations in Hawaii, like our Filipino population that we knew also had health disparities? So Hawaii is actually the only state in the country, I'm very proud of that we've actually disaggregated Native Hawaiian, Pacific Islander, and Asians. And what we found was quite astounding. We found that our Pacific Islanders were actually suffering a huge disparity. They make up 4% of our state population, but when the data first came out, 40% of our cases were Pacific Islander. And then the next highest group was Filipino. So if we didn't disaggregate our Asians, we wouldn't know that. And then Native Hawaiians were after that. So, so that I think was a really important lesson for us, is that power of having to disaggregate it, because these populations were being impacted totally differently. And it really was the power of community sort of asking, what's going on? We need these numbers, we need these numbers. And then the Department of Health responding and bringing that. And what we've seen, and this is a reflection, I think, of what Sheldon was talking about, was that our communities actually mobilized to address this disease. We mobilized without even waiting for the federal government or even the state government to help us. They just got their networks together, their community advocates, the churches, whichever leadership, the nonprofit, the non-government, or everybody just came together. And so there was already a lot going on in the community as far as translating. We knew that there were certain cultural practices that were putting us at increased risk. And so there was already a lot happening before even the first CARES money even came to us. So I think that's the power of community, and you're really seeing a really nice relationship now with our Department of Health and our various communities. A lot has been going on with advocacy, with public health, with media, with getting the word out, translation. But it really started with our own community saying, we can't wait, we have to do something. We're being devastated.
Hey, Martina, I was born and raised in Hawaii myself, and I still wear my zoris around the house. But those who don't study history are bound to repeat it. And what you just described about not even looking at the disaggregated data just, makes me wonder, who was, how did this get overlooked? On a federal level, the numbers of Asian Pacific Islanders are so small that one could say, it's a rounding error. But in the state of Hawaii, where there is such a good population there, did you get any insight as to why it was never examined on a disaggregated basis? Because the findings that you report are significant.
Yeah, there's there's been a lot of changes at our Department of Health as well during this period of time. So I can't really speak to that. I do know that the community was really quite vocal about, we need these numbers, please give us these numbers. I think things came so hard and fast with COVID that maybe there was more a sense of, let's just get these numbers out. But yeah, I wish I could answer that better. I really can't, but I do know that the community was very active in asking for it. And then when they responded, um, you know, initially they gave us aggregated data, and then we said, no, we want more. And then they responded again. So it really was the community. I think it's the power of the voice of community. And I think we're a very small community if you look at us nationally. So I think the lessons for us as Native Hawaiian Pacific Islanders is that we need to speak out. We need to ask to be at the table. We need to ask to be on these committees, because it's really easy to overlook us because we're small. But you know, we're significant parts of populations in some states, like in Arkansas, in Washington, in Utah, and so we you know, we do need to have these issues paid attention to.
It's
The
a
other
real
thing-
lesson learned.
The other
Yeah.
thing you mentioned, Martina, which I think is really important, is Filipinos. And we have a colleague, Ninez Ponce, who's a researcher at UCLA, who's shown data in California that the most impacted Asian health workers are of Filipino ethnicity, and their mortality and morbidity is alarming relative to other groups. And I think that's also an undertold story, because we know that many of the health workforce, particularly in nursing, Filipino women. And we need to make sure that that story of their heroism and the burden that they've had in terms of caring for the families of all Americans, that should be acknowledged, and their needs need to be addressed. So I'm really glad that you brought up the question of Filipinos as well.
Yeah, which is the importance of disaggregating the Asian data, right? Because it's such a heterogeneous group that, you know, to lump us all together, you miss things like the situation with the Filipino community. Yes.
So this has been such an important conversation, and it really shows the importance of data as really the fundamental starting point for a lot of this work. So another way that has impacted us, I think, is there is this perception that Asian Americans are overrepresented in the physician workforce and the health professions, but we know that that's not true of all the Asian American, Native Hawaiian, and Pacific Islander subgroups. And so Martina, do you want to talk a little bit about your efforts to do recruitment and encourage more Native Hawaiians to go into the health professions? And clearly, Dr. Riklon, as one of the few Marshallese physicians, how important that is for the Pacific Islander community as well.
I think there are only two, right, Sheldon? There's you.
That's myself and
We have one in
Dr.
Hawaii.
Right.
Yeah, the workforce, you know, we make up 21 to 24% or so of the population of Hawaii, and the Native Hawaiian population, and we make up less than 5% of the physician workforce. It's been that way for a while. And we also know that that a lot of our health disparate populations respond better when they have physicians from their own backgrounds, familiar, that look like them. And so, you know, we haven't made much progress. So the big question is, what do we do? How can we increase it? So I think pipeline programs are really important, but also looking at what barriers are. I know for Native Hawaiian Pacific Islanders, it looks like things like the MCAT can be barriers. This is a national test. I know that a lot of the pre-med students I work with, very bright, very good GPAs, really struggle with this national standardized test, which we've shown, there's data that shows it really doesn't reflect your success in medical school. at least I work at the Johnny Burns School of Medicine, and we're looking at data right now that's showing that really it doesn't, your odds of graduating from medical school are just as good, whether you come in with a low MCAT or a high MCAT. So why is this such a barrier? Our health disparate populations don't have access to the kind of resources that some of our other populations do for like MCAT prep courses or going to private schools where you have stronger science curriculum. So there's a lot that we need to do to look at why our numbers are so low and what can we do. Because I know once we get them into medical school, they're probably going to be successful. I know that transition from med school to residency, they do really well. They make excellent physicians, and I think a lot of that has to do with our, our upbringing and a lot of the things that make us Pacific Islanders, our values and things. Those are strengths that come out in patient care. But there are these barriers that we have to take a look at, and there's some, like I know at our medical school, we're looking at those very seriously now. And I'm sure it's that way with Pacific Islanders elsewhere in the country. I don't know, Sheldon, you want to talk? I mean, your population there is a little younger. You've just now probably graduating Marshallese high school and college students that might consider medical school. What are you finding over there?
No, absolutely. And I totally agree. And, we definitely need more of us out there. I think it's something that we've always been trying to work at. I know myself and Dr. Alec there on the Big Island, we've been also trying to kind of work on that too. And you're right, we need those faces. We need ourselves to take care of ourselves. It's been challenging. Part of it is, sometimes it's their environment of upbringing. If they're what's on the media that portrays who they are, they portrays that they're not good enough to succeed into college and beyond that. And that's sad to say and sad to see, because I see it quite often. And, I've seen it in Hawaii and other places as well. But, we continue to kind of encourage them, so that's why we take as much of the opportunity that we do have to show our faces in front of them and say, look, this is me, this could be you, because you're definitely smarter today than I was when I was your age. Because they're super bright. I mean, some of these kids are really, really smart. So I know that, they definitely can succeed. We just got to make that connection so they can go beyond high school, go to college, and then whatever they want to do beyond that. So we're hoping and we're working on a few programs in that, besides pipelining, but also mentorship and finding those mentors to actually kind of push them through.
Yeah.
And hopefully we can kind of work together with you folks over at JAPSM in Hawaii as well.
I would say too, it's not to avoid being physician centric. There is also promising and rewarding opportunities in pharmacy, in nursing, mental health workers, so many different aspects of the healing professions that I think we should encourage our undervalued youth to really engage and pursue.
I think it's so important that we be able to instill the dream, that the possibility. I think that's what Sheldon was alluding to, is that some of our kids, it's like, you're a doctor? I didn't know Native Hawaiians could be doctors. So, it's instilling that dream and possibility, but then supporting it, keeping, if they're interested in the sciences, keeping that going. Keeping them going when they have a bad experience, a class maybe they didn't do well in chemistry, and saying, no, that's okay, hang in there, and then they find that they love biology and that, I don't know, but I know sometimes they get discouraged, and that mentorship is so critical for that kind of thing to keep the encouragement going. Yeah.
So I know obviously the focus has been on COVID-19, but NCAPIP has also taken up other issues like diabetes, issues of real concern to communities that in some ways COVID again has highlighted, that oftentimes we are viewed as the model minority and not having these kinds of issues. And so Dr. Wong or Dr. Moritsugu, do you want to talk a little bit about that work?
Yeah, thanks for asking me. I think one of the things that NCAPIP was really pursuing was this whole question of social factors and social determinants of health, as how that relates to our underserved Asian American, Native Hawaiian, Pacific Islander populations. Now, you mentioned COVID-19, and I think what's really clear is that when we identify the category of essential workers, which was a vernacular that we never used even just 1 year ago, now we use this term essential workers. If you look at essential workers, actually the Asian American, Native Hawaiian, Pacific Islander population is kind of disproportionately represented in essential workers. As essential workers, because not only are they health workers, they're service workers, they're restaurant workers, they work in produce, they work in agriculture. And then what we need to do as far as a public health issue is to assure that these different populations of Asian Americans, Native Hawaiians, Pacific Islanders, that we meet their social determinants. We address their social determinants, which are not just determined in terms of their occupations, but also the fact that many of them don't have functional ability in English. They're non-English speaking. They have cultural understandings around how you access healthcare, which does not align with the majority mainstream healthcare system that we have in the United States. So if we are able to approach those things, and not to mention the whole issue of immigration, and whether you're a DACA kid or whether you are still undocumented as a Asian American, we have to facilitate access so that all the opportunity for good health is there for the expanse of our communities. I don't, Ken, if you have anything to add to that. You're muted.
Thank you. Two comments. One, ditto, Winston. Everything that you said with regard to everything with Asian Pacific Islanders, Native Hawaiians. I do want to bring back a thought, however, as you mentioned, Ignatius, about what about other things than COVID-19? We've been focused on COVID-19, the physical challenge of treating an individual with COVID-19. Winston, you started off this session very, very well by focusing on not only the physical needs, but also the mental health needs. And the mental health needs that are unique to the Asian Pacific Islander, Native Hawaiian populations are not necessarily the same mental health needs because of the cultural underlay in all of this. Because as I think you mentioned, Martina, an Asian is not an Asian, is not an Asian. There are many, many different ways to slice and dice the population. So that's one aspect of making sure that we're watching out for the mental health as well as the physical health under COVID-19. A second point that I want to mention really quickly is that COVID-19 has brought home the need to intervene when a disease process has attacked our society. But I think it also focuses on we need to prevent activities and engage in prevention as well as intervention. Some of the unique aspects of our populations are hepatitis B, diabetes, kidney disease, the need for transplantation. All of these are important in terms of prevention. And that carries over into our treatment of COVID-19, because who are those who are most at risk of death and more severe disease? It's those who are obese, those who have diabetes, those who have chronic breathing disorders, those who have chronic heart disease. All of these are lead-ins to making sure that we prepare today for a disease process tomorrow through prevention.
Great. So Dr. Wong, I want to go back to you. You started with sort of referring to both Lunar New Year and Black History Month, and clearly COVID has illustrated the disparities that our communities are facing, but clearly the disparities and the impact on Black and Latino communities as well. So talk a little bit about NCAPIP's role as a physician voice on behalf of Asian American, Native Hawaiian, and Pacific Islander physicians, but really uh, banding together and working together more closely with colleague physician organizations to raise the issues that the racial reckoning the country is also experiencing after the murders of George Floyd and others, and that consciousness of racism in medicine and health, as well as all of society.
Yeah, thank you for asking that, Ignatius. And I'm happy to share with folks that the National Council of Asian Pacific Islander Physicians was a founding organizational member of what we now call the Alliance of Multicultural Physicians, which is made up of not only ourselves, but the National Hispanic Medical Association, the National Medical Association, the Association of Black Cardiologists, and the Association of American Indian Physicians. And why did we put this together? It's because there's so many issues, such as clinical diversity in clinical trials, pipeline issues, as we just discussed, that are really across the board in terms of the ethnic communities and diverse communities that we serve. And I think it's really critical too that we recognize that racism is a public health issue. And it is not a question of a Black issue. It is a question of how racism permeates every aspect of how our communities from all different walks of life are adversely affected by the impacts of racism, not only within the healthcare delivery system itself, but just as a factor in terms of people's psychological, emotional, and chronic disease trajectory. So this is the basis in which NCAPIP is trying to play a role in terms of unifying across the physician community around how do we address racism in a way that is universal, in solidarity, but also providing an opportunity for us to highlight the unique aspects of the Asian American, Native Hawaiian, Pacific Islander experience.
Thank you. So in our remaining minutes, we'll do one final lightning round with our board members and panelists. So what's the one message of hope? This has been a really challenging year for so many of us, but what's the one message of hope for looking forward, and what gives you hope every day to take care of patients, to do the work that you do? So Dr. Moritsugu?
I would like to just focus on one aspect, and that is that we are a helping and a healing profession. And we must make sure that as an Asian, we balance the two.
Thank you. Dr. Riklon?
Just want to piggyback on what Martina had said earlier in terms of community. I think our communities are resilient. I think, we've faced this, we've been devastated by it. We'll survive it. We've gone through many of these before, and I know that we will come out of it. There's a light at the end of the tunnel.
Thank you. And Dr. Kamaka? You're on mute.
You're on mute.
I'm actually going to sneak in two. One is the power of community that Sheldon did. The networking that's happened within our NHPI community, the relationships that have been set, these are primed to address issues coming at us in the future, and also those longstanding issues that we've been struggling with for years: diabetes, cardiovascular disease. So that's been a silver lining from this COVID. I think the other silver lining from this COVID is the recognition that that what's happening in our communities is important and needs to be paid attention to nationally. So those are the two silver linings that I would like to end with.
Great. And Dr. Wong, please close us out in the last minute.
Well, I want to thank everybody for joining us and really giving us the kind of support that you have shown by joining us and encouraging us to move forward. I think I'm optimistic by the fact that, you know, there was an old adage, never let a crisis go to waste. And I think this crisis, this unprecedented, has really brought together not only our family within the Asian American, Native Hawaiian, Pacific Islander communities, but also across, you know, various parts of the profession in health. So there's a new recognition of how all these things interdigitate. And the aspects of confronting racism also happened this last year, which has heightened our sensitivity, our consciousness, and perhaps our determination to overcome these significant barriers in the improvement of community health. The longevity of Americans is going to decrease by 1 year once we go over the COVID-19 epidemic. It's up to us to rebuild the longevity of all our communities, and certainly within the Native Hawaiian, Asian American, and Pacific Islander communities.
So thank you all the participants for attending. Look for our next in this series, and continue to join us in lifting the voices of Asian American, Native Hawaiian, and Pacific Islanders and their health needs, but also their strength, their resilience, and their sense of community as well. Thanks, everybody.
Thank you.
Good night. Be safe.
Thank you, Ignatius.
Thank you.